So I'll hand over now to Voraporn to tell us a little bit about the data with PCV in the PULSAR trial.
Thank you. Now let's move to PCV, which is quite common for our practice in Asia. So the efficacy and safety of Aflibercept 2 mg monotherapy in PCV has been demonstrated in the VIEW-2 and PLANET study. On the left-hand side, you can see the results from VIEW-2 study, which evaluate the efficacy of Aflibercept 2 mg in neovascular AMD patients. But from PCV subgroup analysis, you can see that PCV group also show excellent visual improvement, about 9 letters on average, which is quite comparable to 11 letter improvement on average for neovascular AMD populations. On the right-hand side, you can see the results from PLANET study, which compare the efficacy of Aflibercept monotherapy to Aflibercept plus rescue PDT. And again, you can see that Aflibercept monotherapy resulted in non-inferior visual acuity, comparing to Aflibercept plus rescue PDT. And more than 80% of the patients who received Aflibercept 2 mg monotherapy did not require rescue PDT. So these results confirm the role of Aflibercept monotherapy to treat PCV with excellent outcomes. And recently, the APVRS guideline has also mentioned again that PLANET study provides level 1 evidence that we can use Aflibercept 2 mg monotherapy as the first-line treatment for PCV. In the AIOS2 trials, which also evaluate the efficacy and safety of ranibizumab monotherapy comparing to combination treatment ranibizumab plus prompt PDT. In contrast to the results of PLANET study, ranibizumab monotherapy showed inferior visual outcome comparing to combination with PDT, while ranibizumab monotherapy also requires higher number of ranibizumab injections. What about the other new anti-VEGF agents like faricimab or brolucizumab? So currently, we have no data to explore whether faricimab or brolucizumab monotherapy are non-inferior to the combination therapy with PDT in PCV patients. Those were the results from clinical trials. Now let's move to the real-world data. On the right-hand side, which represent the real-world studies from Japan, you can see that according to the PLANET 2-year results that have about 10.7 letter gain on average. On the right-hand side, the real-world results show 6 to 9 letter gain on average, which is quite satisfied. What about the durability of 2 mg in the real world? From PLANET, they found that 41% can maintain at least Q12 weeks interval, but in real world, they found about 48% can maintain injection interval for at least 12 weeks, which is quite good. In PCV, another important anatomical outcome is the rate of complete polypoidal regression. In RCT, the PLANET study showed about 38.9% 1 year that achieved complete polypoidal regression. What about in the real-world studies? Studies from Korea and Japan actually show even better rate of complete polypoidal regression at 1 year, ranging from 55% to 69%, which show excellent results of using Aflibercept monotherapy in PCV. And here in 2025, we have the new agent with higher molar dose of Aflibercept 8 mg. So PULSAR clinical trials evaluate neovascular AMD patients, but here we're going to present the PULSAR post-hoc subgroup analysis focusing on PCV patients. And this data will include PCV patients from across regions in the world, including European countries, the Asia-Pacific regions, as well as from the America. At baseline in PULSAR study, 296 patients had underwent ICGA, and PCV was confirmed in 139 eyes. Among these eyes, about 70% were from Asian countries. Now we're going to compare results from PCV subgroup on the left to the overall AMD population on the right, and you can see that actually the PCV subgroup did a little better than the overall populations. You can see a mean visual improvement starting from 8 to 9.6, comparing to 5.4 to 7.1 in overall study populations. For anatomical outcome, central retinal thickness reduction, you can see that all arms have rapid reduction of fluid right from the first injection and then maintained through 2 years. And if you look at the number, PCV subgroup provide better outcome comparing to overall study populations. When we treat neovascular AMD as well as PCV, especially if you apply treat and extend in your practice, another important outcome that you want to see is rapid fluid reduction. You want to see how many of them have dry retina after 3 loadings injection, because you can start extended injection intervals right away. So at week 16, after 3 loadings injection, and then we follow up at 8 weeks at week 16, how many of them achieve dry retina? Those who randomized to receive Aflibercept 2 mg achieved dry retina in about 63%. But those who received Aflibercept 8 mg achieved dry retina higher, 68%. And this percentage maintained through 2 years. And those who received Aflibercept 8 mg were randomized to receive either Q12 or Q16 at baseline. At the end of year 2, how many of them maintain at that Q12 or Q16 as the last assigned treatment intervals? And interestingly, about 83% in each arm maintain at least Q12 or Q16, which means that 8 out of 10 patients, which is quite excellent. And also those who assign Q16, 72% of them actually have last assigned treatment interval for at least 20 weeks or 5 months. What about the rates of complete polypoidal regression? Unfortunately, I don't have the data to share with you today, but what we have is how many of them still have persistent polyp at the end of year 1 and year 2. So those who receive Aflibercept 8 mg, 49% still have persistent polyp in year 1 and 51% at the end of year 2. But another important anatomical outcome now is to achieve inactive polyp. So they start about nearly 100%. At the end of year 1, only 23% have active polypoidal lesions, and by the end of year 2, 24% of them have active polypoidal lesions, which means that more than 70% of them achieve complete regression or inactive polyp, which is quite good. And remember that all 8 mg patients receive reduced number of injections comparing to the 2 mg. So in this way, we can reduce burden in clinic while can maintain excellent visual and anatomical outcomes. In terms of safety profile of 8 mg among PCV patients, it was comparable between PCV subgroup to overall AMD populations, and no new safety issue were reported from PCV subgroup in PULSAR study.